Health promotion. My name is Maurice Njenigo. Introduction. Today we're going to be talking about and discussing about health promotion. Health promotion simply means helping people to stay healthy by encouraging good habits, and therefore it will prevent illness. In this presentation, I'll be discussing about the summary of current models of health promotion. Compare at least two models used in health promotion, and and talking about the evaluation of the effectiveness of these models in promoting good health. And I'll be discussing about I'll be discussing and explaining the aims and objectives of a community-based program designed to reduce the incidence of type 2 diabetes through lifestyle modification. Also, evaluate the effectiveness of this program in promoting good health, and the evaluation, the contribution of the World Health Organization to improve public health. Models, health belief models. The developers are Erwin M. Rosenstock, Godfrey and M. Osborne, Stephen Kegers in the 1950s. And the key structure here is that the perceived susceptibility is the belief about the chances of getting the disease. Perceived severity is a belief about how serious the disease is, the serious disease of getting the disease. And the perceived benefit is a belief in the benefit of taking action. In taking action, there are benefits. So these are the beliefs in it. And the perceived barriers is the belief about the obstacles to taking action. So in someone taking actions or taking actions and making moves, there are barriers that hinders one's ability to take action. And the key to action are the triggers that encourage action. Self-efficacy, confidence in one's ability to take action. So one's ability to make move to take action is known as self-efficacy. Champion and Skinner, 2018. Models, trans theoretical model. Developers are the Prochaska and the Di Clemente, 1970. So the stages of change: pre-contemplation, not thinking about change. So this is the stage where you're not thinking about change. Idea of change have not been in your mind. Then contemplation is thinking about change. This is a stage where you're not thinking about change, but you've not make any plans, no plans and no move yet. Preparation, this is a planning to change. So this is a stage where you've actually decided that you want to make change. So you've started planning and making moves, and not yet making moves. So action, so actively making changes. So this is a stage where you've decided to start making change, and you start making moves, and yeah. Cue to action, triggers that encourages action. So these are the signs and the informations and cues that encourages actions. Maintenance, keeping up the changes over time. So after you started making action, you started making saying signs and encouragement, you have to keep on updating changes. You have to keep on changing. You have to keep on evolving and making maintenance over time. Social cognitive theory, and the developer is Albert Bandura. The key structure here is self-efficacy, belief in one's ability to perform action. Bandura, 2014. Observational learning by watching others. So this is a method used by you you watch others and you learn. But it's like practical. You as you watch others by looking at others, you learn. Then you learn properly and effectively. Reinforcement, the rewards or punishment that affects our behavior. So in every behavior, the rewards and there are consequences that affect it as well. Models, theory of planned behavior. The developers are the ASGEN, and the key structure here is attitude, personal views about the behavior, ASGEN 1991. Subjective norms, social pressure to perform or not perform a certain type of behavior. So this is like a peer pressure. You want to be accepted, or you have to do something for them to accept you. So these are subjective norms. Perceived behavioral control. These are believing how easy or hard it is to perform this behavior. Ecological models. Developers are the Uriel Brenner, Daniel Stokos, and Kenneth McLeroy. And it focuses on different levels of influence on health beliefs or health behavior. Individual, personal knowledge and individual skills. Interpersonal, social networks and supports. Organizational is institutions and organizations. Community is a community relationship, Glans and Rema 2021. Public policy, like government policies. Maintenance, keeping up the changes over time, keeping up to date. Comparison. Earth belief models and trans-theoretical models. Focus and approach. Earth belief models looks at individuals and focusing on how people make decisions about their health. So Earth belief model they focus on people and on how people make decisions in their lifestyle. Champion and Skinner 2018. And why trans-theoretical model views behavior changes as a process, and they consider in different stages of readiness for change. Procaster et al. 2018. Key components. Earth belief models consider beliefs like substantiability and the benefit of action, while trans-theoretical model divide changes into stages like contemplation and action. Application. Earth belief model is used for understanding preventive behaviors, while trans-theoretical model is applied in long-term behavioral change efforts. Evaluation of effectiveness of Earth belief models and trans-theoretical models in promoting good health. Earth belief models strengths target specific beliefs effectively, but doesn't address habitual behavior well. So Earth belief models target some beliefs, but not it targets some belief effectively, but not all, and it doesn't address habitual behavior well as well. So, and trans-theoretical models, their strength is that they provide clear framework for change, but stages may not always fit real life behavior change. Trans-theoretical models, they provide a clear framework for making change and all that, but their stages may not always fit real life behavior change. Health promotion initiative. Healthy living for diabetes prevention. And their aim is to reduce type 2 diabetes through lifestyle changes. Their objectives is that they educate community members about the risks associated with diabetes And they encourage community members to adopt healthier eating lifestyle habits, and they motivate community members to engage in regular exercise, and they provide ongoing support to help community members maintain lifestyle changes, like like they support, they go, they monitor you, and they track and monitor health markers of community members over time. Evaluation. The evaluation of the healthy living for diabetes prevention is that they are responsible for conducting surveys to measure changes in knowledge about diabetic risks, and they assess changes in eating habits among community members. They track exercise habits to evaluate consistency and improvements, and they monitor the continuation of healthy habits over time. They measure improvements in health members to determine overall health outcomes. Improving public health. World Health Organization (WHO). The World Health Organization is a United Nations agency that works to improve health and prevent diseases worldwide. Founded since the 1948. Their role is that they lead the vaccination efforts, which is the eradication of smallpox, and they coordinate outbreaks like the Ebola and COVID-19 outbreaks. They also set global health standards. For example, the International Health Regulation, and they promote health research, which is the Tropical Disease Research World Health Organization 2019. They also advocate for universal health coverage and support primary health care, Gustin L 2020. They address social factors affecting health, and they collaborate on global health initiatives like the non-communicable diseases. Improving public health. Evaluating the contribution of the World Health Organization. Their success is that the eradication of smallpox made progress against polio in 2014, Gustin, and they provided leadership during outbreak like Ebola and COVID-19. Like in 2019, when the outbreak of COVID-19, they are the one that provide leadership. They step up and they provide leadership, and they provide support worldwide. The challenges they might have is that the varying commitment from member states. So the members, their commitment changes over time. So that's one challenge that they have. Another challenge that they have is funding limitation. They might be struggling funding, or they are struggling with funding. And also they adapt to emerging diseases, new diseases that showcases. They don't always, they adapt, but it's not. They're adapting to the diseases. It's a challenge, but they overcome. Then climate change, which are the Hoffman and Silverberg 2018. Conclusion: health promotion encourages healthy habits and prevents illness through models like health belief models and trans-theoretical models. Initiative like Healthy Living for Diabetes Prevention focuses on awareness, diet, and exercise. So initiatives like the Healthy Living for Diabetes focus more on awareness on how people live, people lifestyle, their diet, their way of diet, exercise, what the type of exercise they do. Could be that particular type of exercise for these particular reasons. Since the 1948, the World Health Organization has been crucial in disease control and health crisis. So since the 1940s, they have been what they consider have been helpful in disease control and different health crises like COVID-19 and Ebola, despite facing different challenges. Thank you. These are the references.